It's been described as a public health emergency. Yet despite domestic abuse victims having more contact with the NHS than any other public service, a fresh warning today that their unique position isn't being utilised and vital opportunities to save lives continue to be lost.
The NHS failed Jessie from the start. We were screaming out for help.
Phyllis Daly fought for years for a landmark judgment which explicitly linked her daughter Jessie's suicide with the domestic abuse that she'd endured. She first spoke to Channel 4 News almost 3 years ago, expressing hope that the system that failed Jessie would fundamentally improve to better protect victims.
It's going to be a national shock when people start realising.
But she's been left wanting and still fighting for change.
Who do I blame for what happened to my Jessie? Obviously, first off, the perpetrator. Blamed him 100%. And I can hold the professionals equally to account because Jessica was brave enough to put her hands up and say I was in a domestic abuse relationship. And that's the point. I thought the professionals would put their arms around her and protect my daughter and make her safe. And they failed her. They failed her in so many ways. She reported 11 times domestic abuse, but that professional curiosity wasn't shown. They didn't even ask the perpetrator's name. I think the health professionals failed her more than any service going.
Do you think what happened to Jessie could happen today?
It is still happening. It's not it could still happen today. That is still happening today. Unless we educate the health professionals more, that won't change.
Time and again we hear of missed opportunities to spot the signs and connect the dots, of lost chances to intervene and support victim survivors of domestic abuse. The government have pledged to halve violence against women, but already campaigners are warning that this pledge will fail unless they're included in healthcare strategy. And the government's 10-year NHS plan barely mentions the vital role that professionals must play to change the tide on this epidemic.
Part of that NHS plan for England was to modernise access to healthcare.
We'll transform the NHS app so that it becomes an indispensable part of life for everyone.
But there's fears that that could inadvertently become a tool for perpetrators.
Everything was monitored, everything was controlled, there was no freedom.
Sarah, not her real name or voice, says allowing access to NHS records via phones risks pushing victims away from healthcare.
No, because it makes victims more vulnerable, and victims perhaps that are experiencing physical violence won't be able to get treatment, even on the quiet, because he'll find out. And I think when you're in these relationships, you're constantly doing a risk assessment, and I think it will make the benefit of accessing healthcare not worth the risk.
And what was your experience of the NHS at that time?
Unfortunately not good. My midwife asked me about domestic abuse, and she was the domestic abuse lead for the area, but she asked me in front of my ex. So had I even made a funny face, I would have been in so much trouble when she left. So I sort of joked like, oh, ha, 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 no domestic abuse here, because I had to survive. So asking a victim about abuse in front of the perpetrator is a ridiculous thing to do and a high-risk thing to do.
Do you think there is a chance to intervene much sooner?
Oh yes, absolutely, absolutely. And I went in at one point with chest pains, and no one asked me, are you under a lot of stress? Is there something going on?
Clinical guidelines state a woman should be asked about her home life while alone at least once during antenatal appointments. Sarah says she's still not free from her abuser. He continues to use her health records against her in the family courts. The charity Standing Together Against Domestic Abuse has called for better coordination between services, more training and more money to save lives.
Do you think the NHS is failing victim survivors of abuse?
I think systematically the NHS is currently failing. There is definitely an element of not seeing it as their issue to tackle. And not seeing their responsibility in terms of identifying and responding. Coercive control and domestic abuse is so insidious that the opportunities victims and survivors get to access help and support can be very few and far between. And so when they're seeing a GP or when they're seeing somebody in a sexual health clinic or accessing a nurse in an A&E department, that might be their only opportunity to seek support. And we know from speaking to victims and survivors that they want somebody to ask them the question, are they safe at home? Is their relationship safe?
The government told us they're improving the response to domestic abuse in healthcare settings as part of the 10-year NHS plan and remain committed to halving violence against women and girls by 2034, while NHS England said the health service was learning lessons from past failures. Driving all that Phyllis does is her beloved Jessie.
My Jessie was a very beautiful young lady. She was such a caring, living person. She just lived life to the full. I have such passion and drive to make change. I can't bring my Jessie back, but I can help other Jessies out there.
Determined that no others will feel the pain of a death caused by domestic abuse.
Dame Nicole Jacobs is the Domestic Abuse Commissioner for England and Wales. I spoke to her earlier and began by asking her if she agreed the NHS was failing victims of domestic abuse.
Well, I kind of see it from both sides, where I know there's so many champions within the NHS. There's so many nurses, doctors, safeguarding leads, midwives, who for years have tried to carve out services for domestic abuse or a response to domestic abuse within their particular service in the NHS. And what I feel is that we're ignoring that incredible work. We're ignoring victims who tell us that health services will be a first port of call, and we're ignoring incredible work that we could be progressing and we could be seeing as consistent throughout our health service. So we're losing ground.
But given that in the NHS, women who have mental or physical health problems that might be a clue to domestic abuse are seen, at that kind of front door. What's going wrong here?
What's going wrong is that we're not planning within our strategies within the NHS and how that links to our strategies for domestic abuse, for violence against women and girls. We're not making those links, and we're losing the kind of leadership and direction. And what that means for victims is that the one place that they may feel safe, the one place that they may feel able to speak to someone alone, a place that they naturally think is there to help them, isn't helping nearly as much as they possibly could.
I mean, couple that with what we've heard this week about the DASH questionnaire, which, has been used as the main tool to assess domestic abuse for many years. The safeguarding minister said this week, well, it's just not working. I mean, should that have been scrapped long ago, do you think?
That checklist is a risk indicator. It's the kinds of very sensible questions that any frontline practitioner should be trained and feel very confident to ask. That's not the only question to ask, or the set of questions to ask. It's not the only judgment you should have.
But there's no substitute for fully trained staff who are really on it.
Absolutely. And we have violence against women and girls strategy that has not been published yet, is not linking to the NHS 10-year plan. We have got to see this as a sense of urgency. We have victims and survivors of domestic abuse who desperately need help within mental health services, children within CAMS, so many opportunities lost because we're not prioritizing.
Well, that violence against women and girls strategy is due out very soon. What do you want to see from it?
I want to see a focus on prevention, a focus on this mission-led approach, where every single government department is playing their part. And what I'm afraid is that the one thing I know from my own interaction with victims, surveys with victims and survivors, is that health will be a very first port of call. And we're not seeing any evidence now yet that the Department of Health and Social Care is really doing the kinds of very practical things that they could be doing to create a more consistent response.
So the Department of Health and the NHS needs to be at the heart of that violence against women strategy.
Need to be leading it, needing to be at the heart of it. There's such opportunities that you could that could be made within GP surgeries, within neighbourhood health centres.
Well, the government does have this flagship pledge to halve violence against women and girls by 2034. Are they off track at the moment?
They will not do it if they are not looking at the evidence. And the evidence will tell us that one of the first ports of call will be health services.
Dame Nicole Jacobs, thanks very much.
Thank you.
And if you have been affected by any of the issues in that report, you can seek help by going to channel4.com/support.